past November, I was invited to attend ASPiH at the famous Majestic Hotel in Harrogate, England, alongside other SimGHOSTS leadership Ryan Ealing and Joey Falma. ASPiH stands for the Association for Simulated Practice in Healthcare, which had its 4th annual UK-based meeting with more than 400 in attendance.
Health Education Yorkshire and Humber, as it's now called, actually funds the simulation and the Clinical Skills Network, and we're delighted to do that because it actually improves patient care and it also gives a whole load of confidence to the people who are actually learning to be clinicians.
I had a chance to sit down with current ASPiH President and Director of Nottingham University's Trent Simulation Centre, Dr. Bryn Baxendale, to learn more about this innovative event and professional organization.
ASPiH served the purpose of uniting that community under one umbrella, of demonstrating that actually you could have very meaningful activities, meaningful events, conferences and networking from involving members from across all of those specialties and professions. And it really enabled those communities to develop their own endeavours, as well as link into, I think, a growing recognition professionally of the place of simulation, and increasingly linking to a greater political and professional awareness of the need for innovation and new ways of thinking about how to educate and develop the workforce, how to improve the quality of care. And simulation in its breadth of modalities and other now increasingly numbers of newer mobile learning technologies really, I think, reached into ways of doing that and making that accessible, making it educationally coherent and making it centre on improving quality of care for patients.
Because in the UK government plays a larger role in national healthcare, the opening keynote by Professor Ian Ellis, Chair for the UK Council of Deans of Health, was a powerful reminder to attendees about the challenges in healthcare the countries face that simulation can specifically address.
And as you all know, one of the biggest challenges is the amount of time it takes between new developments and them actually being disseminated and adopted, whether in the NHS or in other health systems. So that's the challenge, as to how can we use perhaps simulation in order to update people, get those embedded in practice. And that's one of the key challenges around safety. Why is it that in Hospital A, people are up to date with things which have been discovered and put into practice years ago, and 10 miles away, it's like that has never been discovered and it's not being adopted. So how can we get that systematic adoption?
In the multi-day tech room, simulation technology specialists shared their homemade do-it-yourself simulation lab innovations and presented to one another about the recent operational successes of their programs. Ryan Ealing, event chair of SimGHOSTS, presented on consolidating control panels in the sim control room, and I presented on filmmaking techniques which can increase sim lab realism and learning opportunities. Jane Nicklin, Strategic Clinical Skills Advisor at Leeds Metropolitan University and ASPiH Tech SIG co-chair, spoke with me to explain not just the rapid growth of support by ASPiH leadership for technical course content, but also the Technical Workforce Development Project with Higher Education England.
Last year at ASPiH down in Oxford, they launched the tech room, and it ran for one session of conference with a couple of presentations. Very well supported, but it was a new venture. This year, wow, we've got bigger and better within that year. And in actual fact, the tech room is running for the full 2 days of conference, 4 sessions in total, which I think is not only due to the evolving role of the technician in our region, but nationally we are beginning to reach out, I think, to the technicians. They're beginning to feel a little bit more needed, more worthwhile, and that things are going to be provided for them. Part of my role in the regional clinical skills and simulation project is obviously working with the technicians that are in our organisations, and very early on we found that the technicians come from wide range of backgrounds, but they don't feel that they're recognised for the role that they play. It's a multifaceted role. The skills that they've got, most of them are homegrown within their facilities. A lot of them come from AV, IT background, but equally so, some of them have been clinicians, some of them, nurses, ODPs, so they come from varying backgrounds. But what they haven't got, apart from the recognition for the role, is actually there's no career progression for them. There's nowhere for them to go to learn more. They're learning from their clinicians, they're learning from their colleagues, but there's nothing being provided specifically for them. So one of my key roles within the project was actually to look at the role, to scope the role within our region and beyond. We actually did a national scoping exercise to try and see how we could help not only these guys, but also the younger element, the young people, to be made aware of the technician role and all that it offers. Very lucky, got some funding from our region through HEE, Higher Education England, to actually fund a pilot project of clinical skills and simulation technicians. So first one in the country, obviously, new role for apprentices, and we are currently advertising the jobs, and next month we will be doing assessment centres to ultimately get our technicians for each organisation in the region.
Learn more about this empowering organization and the November 2014 event by visiting aspih.org.uk. Watch part 2 of our ASPiH 2013 coverage below.